Hello everyone, and welcome. I'm excited to kick off our presentation today with episode 26. This is our very first slide, so I want to start by saying how glad I am to have you all here. Today, we're going to explore some interesting insights and key topics that I believe you'll find valuable. We'll briefly cover the main points, so you'll know what to expect as we go along. Let's get started and dive into this exciting journey together. So let's talk about using the principles of standard precautions, specifically when a nurse should wear gloves during different nursing interventions. Now, gloves are a key part of infection control, helping to protect both the patient and the healthcare provider. In this case, we're asked to identify which of these activities would require gloves. Providing a back massage, for example, generally doesn't involve contact with bodily fluids or tissues that could transmit infections, so gloves aren't usually necessary. Feeding a client is another activity that typically doesn't require gloves, unless there's a specific concern like a wound or an infectious condition that might be transmitted through saliva or other secretions. Providing hair care is also generally safe without gloves, as it involves external contact with the scalp and hair, which are less likely to transmit infections. However, providing oral hygiene is different. This activity involves close contact with the mouth and possibly saliva or other bodily fluids, which can carry pathogens. Therefore, wearing gloves is important here to prevent transmission of infections. Remember, the key point is to assess the risk of exposure and use gloves whenever there's a chance of contact with bodily fluids or mucous membranes. This aligns with our overall theme of maintaining safety and infection control in nursing practice. Let's talk about providing oral hygiene. Maintaining good oral hygiene is essential for overall health and well-being. It involves regular brushing and flossing to remove plaque and prevent cavities and gum disease. Using the right techniques and products ensures you're cleaning effectively. Remember, consistency is key. Brushing twice a day and flossing daily make a big difference. Also, don't forget to visit your dentist regularly for checkups and professional cleanings. Good oral hygiene not only keeps your mouth healthy, but also supports your overall health. So, making these habits a routine is one of the most important steps you can take towards a healthier lifestyle. When it comes to providing a back massage, it's important to remember that you only touch intact skin. There's no contact with body fluids during this activity, so gloves are not necessary. This helps keep the process simple and safe. Similarly, when feeding a client, there's usually no direct contact with body fluids or mucous membranes. It's a routine activity focused on nourishment, so the risk of transmission is minimal. Providing hair care involves working with the hair and scalp only. Since there's no exposure to body fluids in this case, gloves aren't required here either. Now, why are these options incorrect? Well, activities like providing a back massage, feeding, or hair care generally don't involve contact with body fluids or mucous membranes, which are the main concerns for infection control. It's critical to understand these distinctions to follow proper safety protocols and protect both ourselves and our clients. Now, let's talk about when gloves are necessary. Gloves should always be worn whenever there's contact with body fluids or mucous membranes. This is crucial for protecting both the patient and myself from potential infections. For example, during oral hygiene procedures, I might touch saliva or the inside of the mouth. Since saliva can carry germs, wearing gloves helps prevent the spread of bacteria or viruses. Remember, gloves are a simple but effective way to maintain hygiene and ensure safety in our practice. So, whenever you're working in these areas, don't forget to put on your gloves first.